I'd like to welcome all of you to another very informative session on Shiksha. I'm Bhagyashri Gupta, your moderator for this session. And let me first tell you the topic for today's session, which is all about life of an MBBS student. And now I would like to welcome our panelists for today's session, who themselves are MBBS students. So I'd like to welcome Rohan Patil, MBBS student again from Mahadevappa Rampur Medical College, if I've pronounced it right. And Koshika Pandey, again MBBS student from GMERS Medical College, Vadnagar. So I welcome both of you for this session, and thank you so much for taking out time and sharing your experiences of being a medical student with all the aspiring students out here. So I would start with a very basic question. How is life at a medical college, since both of you are medical students and you have gone through it, and I'm sure you'll be experiencing it more. But how is life at a medical college? Koshika, if you would like to start off.
Hello, ma'am. Yes, it's like when I was in 12th or just say 10th, we just dream of going to a medical college. Like we thought it like a scene which was seen in the movies, that we will go to college and this, and it's really hard. I would say, means it. The college life is really very interesting, but you have to maintain it correctly with your studies, with academics, and with your personal life and everything. If you are managing it right, then it's really fun and really interesting.
Right. And Rohan, what would be your opinion? What's your take on this?
Yes, I can completely agree with what Koshika just said. And for me, medical life was, my parents are doctors. So for me, it was all about the medical background and all of that. But for me, I was always into medicine when people used to get the defibrillators out and rush with the ambulance. And I always wanted to know what is happening there, or how are they treating them, how is the triaging, or all the details of it. And it got me into it. And I would say now I'm in final year, medical life is treating me well. And it, as we join in, we would have long hours of college, and we would be waiting for the clinicals and the hospitals to start. And as it begins, it eases up and we start to explore more and enjoy more. That's what I would like to say.
Right. So I think, Rohan, since you're in the final year, you have already experienced a lot, in, I think, last 3 or 4 years. And Koshika is in mid and she has to travel a bit more. So, Rohan, like, if I would ask you that since Koshika would be a junior to you, what would be your suggestion to her for the coming years at a medical college?
All right. So there are different paths to that question. So as we enter, like I said, there are long hours of college, and there are just practicals, and we have lots of theory classes. And at one point, we'd be left wondering on how do I imagine this, or how do I put this to thought, and how do I memorize all of this. But then as we progress, the subjects which we learn, they don't just remain in that year. We carry it forward with us. And it's always like a memory, and we keep repeating it over and over again. So what I would like to say is, the subjects forward, they will be bigger, but they're very simple, and we just have to do a little bit of daily studies and look into each other topics and read over and over again. And some of the topics will be very hard, but the good part is we have our friends with us, and we have our teachers, so we can always have a group discussion with them. And who better to understand our situation than our friends and family?
Absolutely. I can totally agree to that, Rohan. All right. I'll just take a question coming here from Sanjari Anand Verma. Okay, I think she's appearing for 12th right now and not sure about MBBS. So wants to know, can you suggest a good course that give me bright future and good placement? So Rohan, would you like to help her out with this?
Yes. So Sanjari, I see that you are in 12th right now. So right now, not just medical courses, but if you are genuinely interested in the course of doing something in the medical stream, then we have wide array of topics and courses which you can take up. And if you are inclined more towards the engineering part of it, then you can take up biomedical engineering and help in making the different medical instruments which help us today in diagnosing and investigations. But you can, if you are interested in just one field of medicine, you can go for pure sciences, or you can go for just simple bachelors of those subjects. And right now, all the world needs more of researchers and all those people who diagnose diseases, and we have to come up with a course of treatment. So even for those people, the researchers and the scientists, there's a huge demand for them. So there's a huge course which you can take. Right now, at the top, we have geneticists for diagnosing all the intrauterine diseases, and for the gynecologists, they need geneticists a lot. And I would say microbiologists, they are also in a huge demand right now in the COVID-19 pandemic. And pharmacologist will also be very helpful, and also has a wide range of placements. You can get into medicine production or forming medicines and into the research part of it also.
Right. Thank you, Rohan, for that answer. And I think that would really help Sanjay with that. Okay, I'd like to take a question from chat session over here. Renu wants to know, and I think it's quite an obvious question that aspiring medical students would have. Is MBBS too hard? Koshika, you want to answer on that since you're in mid of it?
Actually, I just completed my first year, and today, for the first time, I just got into the OT for surgery, and today I witnessed 2 surgeries. So I can tell you, in first year, you just have to study, right? You don't get chance to interact with patient that much. But trust me, for the first time when I was in the hospital and interacting with the patients and taking their histories, it was really fun, and it was really interesting to apply the knowledge which you have learned previously. You just know that, okay, yes, I have studied this before and this is this. So it's really helpful. Like when you will study like theory portion, you'll feel like it's really boring, it's really hard. So just make a group and group study. I guess I would any day prefer group study because it is really helpful. And hard, it depends upon the person, right? If you are doing your daily work every day, then it's not that much tough. You can easily manage.
Right. Thank you, Koshika, for that answer. I like to take a few more questions coming in from here. So another question, another interesting question, I would say, and again, a very common question from students, is only MBBS enough, or do we need to do MD? So Rohan, if you would like to take that.
Yes, I'd like to answer that. Right now, MBBS, just MBBS, yes, you can do it, and you can go for it and just stay as a doctor. But if you want to, from a financial standpoint of view, you would need to do more. But standalone MBBS works very well, and most of the doctors which move abroad have only MBBS degree with them, and they over there they go and pursue their residency. So and residency is a must in most of the other countries, where you can't just practice MBBS. You need to have a specialization in one of the subjects. So I say MBBS, even in India, is very good, and you can practice it. The government colleges and the rural places do need more just MBBS students for data collection and screening purposes.
Right. Thank you, Rohan, for that answer. I could see some more questions pouring up here. Okay. So Saurav has a similar question. What are the other career options after doing MBBS instead of becoming doctor? So I think that's a really interesting question. And Rohan, I would want you to please answer this.
Yes. The other career options after doing MBBS. Okay, so after you finish MBBS, there are, if you are interested in going for a certain type of subject, then you can directly go into that kind of internship and just work under some doctor. or if you want to take a gap year, let's assume you want to take a gap year, then there are a set of doctors who work in research institutes, and you can go under them and work for a certain number of years and gain more research experience. And after MBBS, there is one option which I told is moving abroad. So you can start preparing for your USMLE or PLAB. And just medical students, what I would say is there's nothing stopping you from doing anything more than just MBBS. And because my own friends, they are into administrative work, business, hospital management, business management. So you can take up those courses. You can do an MBA, and you can go into manage how hospitals are done and how to get it into the corporate world and how to manage it all as once. And there are parts where you can do a tie with the pharmacy and how they work. And I think that's what I would say. And I would like to hear what Koshika also has to say.
Sure, I think they have a lot of queries coming in here. So we like to take some of the queries over here. Okay, so Tanya wants to know, I have just cleared the Neet with 150 marks. Will it be easy to read MBBS? I have joined in private college. Okay, so Koshika, would you like to answer that?
Yes. I would say everyone, whether someone is in AIMS or whether someone is in private college, when you start MBBS, you all are on same platform. Like you are once again starting from grade one. So don't like see yourself as you are in private college. Just stay yourself, keep yourself positive by saying that yes, apart from all of above students, you are doing MBBS. Don't think that too much. You will do fine. Just I would say that whatever is taught on day, just revise it and cover it the same day. Trust me, this will help you a lot, because in the initial days I was lagging a bit, but when in the second sem, really I just did everything with time to time, and that will really help you, and you will be able to cope up.
Right. Thank you, Koshika, for that answer. Okay, so just another question coming up here. Apart from MBBS, is BAMS good for future or placement? Rohan, would you like to help on with that?
Yes. Speaking about BAMS, I would say it has a scope, but only if you're planning to practice it only in India, it would be of great use. And because many people are more towards BAMS and all the Ayurveda, and so osteopathic medicine, there are a lot of types of medicines which are coming up. So if you want to go for BAMS, you can very well go for it. But if you want to move somewhere else, abroad or something, or do more than just practice medicine, then you can get into one of the research institutes and practice there.
Right. So let's just come to your daily routine at a medical college. I mean, your studies, extracurricular activities, managing time with friends. So, just summarizing up, how is your daily routine? How do you cope up every day? How do you manage everything together? Because I could see questions coming up regarding how you manage studies, and you also take part in extracurricular activities. You also hang out with friends. So do you actually get that time apart from studies? I mean, a lot of people have this myth that MBBS students are always into books and they don't get time for socializing. So Rohan, is that really true?
I would say that there's plenty of time, and 5.5 years of medical life is, I think it's a boon, and we are absolutely grateful to have the 5.5 years of time. And for some people, it is less, and they just keep longing for more and more. So what I would say my daily routine looks like is, in my first years, for the first part of the question during first years, I would let Koshika answer it how she goes by, and I can answer the rest of the years.
Sure, Koshika, you can take over.
Uh, uh, Here we have our morning lectures from 9 to 1. We will be having our theory classes, then 1 to 2 we will having the lunch break. And then 2 to 5 again practical classes. So we'll wake up like 7 in the morning and get ready. Then 8 o'clock we'll have our breakfast in the canteen or mess, depending upon. Then 8 o'clock we will have our theory lectures. 9 to 1 we'll have our theory lectures. Then the 1 hour, the 1 to 2 time, it seems really very less. Like you have to rush out to the mess, come back to the lecture hall, and especially in the summers it's really hectic, like the sun and the everything is very then you have to go for the practicals. The anatomy practicals are very interesting, like you have to do the dissection. So we have a craze over there. For physio and biochem, in the initial phase we'll be like just jana hai. Then slowly it will like ठीक है जाते हैं, ऐसा हो जाता है फिर.
Okay, so Koshika, I have two set of questions for you since there are questions coming for first year. So firstly, Ashisha wants to know, how have you survived during the first year? What were your do's and don'ts, if there are any, for the first year, like they need to follow?
As I have mentioned earlier, I strictly stick to the thing that whatever was taught in the morning in the theory classes, after 5 o'clock, I'll come half an hour for freshening up, and then after that, 5:30 to the dinner timing, I'll revise everything. Then after that, if you have revised day to day, then you have plenty of time, right? Like after 8 o'clock or after 9 o'clock, you are free with your studies, and at the end you don't have enough burden because you have read everything once, and for exam you just have to revise it once, and you can't mug up everything. You have to understand and write it in the exam. So I would must say that do everything on the same day so it will be retained to you. This is really important.
Right, and just extending another part to the question, since you mentioned about anatomy, so Alicia wants to know how to study anatomy in the first year itself.
Okay. We were actually, I think, very lucky because I'm talking to my friends also who are at different colleges. Our anatomy faculty is very, very, very nice, I would say. Like, if they teach you some topic in the class, I'd say 70% you will then and there remember in the class only. And the 30% which is left, that you have to come and do it on your own. So if your faculties are good, then that's a really good thing. Otherwise, there are various video lectures available. You can go through them and make a habit of making notes. Like it's totally depends upon you. I'm a person who used to write notes of anatomy in the first year. So it really helps, like writing in the exams also, it will be helpful to you.
Right. So thank you, Koshika, for that answer. And I'll just come to Rohan. Rohan, now you can, extend the same question and continue, please.
Okay. So answering the first part about my routine, it would be during my first and second years. They were like second and third years mostly. They were like transition years into my fourth year. So in the second year, our practicals had started, our clinicals. So we had our clinicals every day from 9 to 12. And sometimes it used to extend up to 12:30. And it is very interesting. So our ratio of practical to theory classes is 1:1, absolutely. But in our second years, we have more of practical classes for our pathology and microbiology and forensic, of course. But in our third years, during our ENT and ophthalmology, I would say the clinical classes were extremely helpful. So whatever we used to go and learn there, it was a completely practical point of view, and we know what's happening and what to find and what to notice. So when we come back to the theory classes, their theory classes will have their own parallel set of topics going on. So when we try to correlate both of them, we see that we can enhance our performance by so much more. And I would say now that I've come to final year, I've figured out how my daily routine is. So I get up and I have an 8 o'clock class. So I have my breakfast, because if you don't have a breakfast in the morning and we need to stand for 3 hours in the hospital, so most of the people will faint during surgeries and all. So our doctors and all of our friends, we just emphasize on having food at regular times. And so we have our 8 o'clock class, and after 1 hour of theory, we directly rush to the hospital. And depending on which department we have for that month, we attend all the class, and then we have 1 more hour of our theory classes. So there, our classes come to an end for final year. And during our clinical part, what I would say is the teachers teach in such a way that they expect you to know a certain kind of topics and you to answer in certain kind of way. And in the beginning, you might feel that you don't know, or you feel a little burden for it, but it's completely normal. All the medical students are in the same boat. So that's when we pick up on, okay, this is how we're supposed to learn. These are the important topics. So these are the flow charts I'm supposed to follow and all of that. And I would say in the evening after lunch, we are mostly free, but on some days we do have our seminar classes and our revision classes and our case presentation for only our practical groups. We do have that. So I would say that is basically my routine. And after that, I would come back and miss out, see what all I've missed out, what they have answered, what our teachers have taught, and try to correlate everything and study for about 3 hours, finish off all the topics. And after that, I would get back to if I have any work elsewhere, I would do that. And then I would go and meet with my friends. So Saturdays is mostly a time off, and Fridays are time off. So we try to go and have uh, some time with our friends. So mostly it's a chai around the corner in the hospital or our hospital canteen. We try to have it there. So I would say we have plenty of time in the medical stream.
Thank
So
you, Rohan,
that's
for
what I
that.
need to say.
Right. Okay, I could see another question coming up from Ishwarna and need some help. So let's just try and see if we could help her out. So Ishwarna says, I've joined MBBS this year, but I have finished my 12th in 2018. It's too hard to study for me, anatomy, biochem, and physio. So please guide me how to study all these 3 subjects easily. In my college, within a week, they have completed general embryology. So he or she wants to know how to go up to staffs in colleges and complete his syllabus. And he also wants to get some kind of guidance on, how to study each subject easily and understand, because he's facing some kind of problem. He's not able to manage studies in evening. So can you just guide him throughout the entire thing, Rohan?
Yes. So even when we joined our first years, we all the topics and all the topics, it just some of them just seemed alien to us, and some of them were like, yes, we learned this in 12th. So we might be flabbergasted by all the topics being rushed towards us at the same time, especially embryology, where all the terms seem new and there's a development process and everything's new. But to tackle that, I would say watching videos for embryology. We have really good videos on YouTube, or we have embryology models present. So we can like see the transition of how a uterus just gives rise to a fetus, and all the different parts we can beautifully illustrate and see it. So even systemic wise or the otherwise. And for the second part, excuse me, can you please repeat the second part of the question?
Yeah, so I think he wants to know about how should he manage studies in evening, because he's not been able to cope up and he needs some kind of guidance so that he could, go up to his staff and ask them for their help.
Yes. So in the beginning, we find our teachers to be very intimidating because all of them are doctors, and you would expect them that you know something, but that's not the case at all. So even when I was in first year, I didn't know topics. I used to go to the PGs and I used to go to the tutors there, and I used to ask them to explain me a few topics and how does this go from this to that, and why are these in this kind of way. And they used to explain me beautifully. And it does not matter if you know something or you don't know something. The part is that you go and you're asking for help, and they are more than happy to help. And I would say if you want to cope up with your studies, I would say you'll have to be regular with it. And as Kaushika said before, having a study partner or a study group benefits a lot. And we can cover large sums of portion in such incredible shorts of time that we might be surprised by ourselves. But I would say that would be the point. And if you think that you are forgetting something, or you're not able to remember something, I would say keeping post-its or something and sticking them somewhere and just keep on looking at them over and over again would be helpful in your studies.
Right. I think that would really help him and understand things better. Okay, so let's just come to some more questions. Koshika, I would want you to answer this since you have appeared for Neet. So a question comes up: when to start preparing for Neet PG, and should we join coaching for the same? So Koshika, what would you like to suggest?
Actually, I'm also struggling with the same question right now. Uh, Actually, I have talked to my seniors, some of the seniors. They said that you should start with the second year. But some of them are saying that just let it be a BSAE and take some coaching or marrow and whatever from the next year, like third, first. So let me clear out with myself first, then I'll let you know. Sir
Okay.
can help us.
Sure, sure. We'll come to Rohan for this as well. And just extending another part of it, Koshika. It's a very obvious question. Like in this entire journey of 1 year, do you feel like exhausted out, or you feel like okay, just leave it and let's just do something else? And MBBS is quite difficult. Do you sometimes feel like that in this entire 1 year? Did you feel something like that?
Many a times, like here we have our exams in 15 days, so we have one of the exam, whether it be an art, physio or biochem. So sometimes you are not really ready to appear for the exam, then you feel like why I am here. uh, but it's just from 100, just one part, right? But as I said, today I have seen surgery for the first time and interacted with the patient. It really feels very nice. Like in first year, you will feel like what are we doing here? We are just studying. What will happen with this? But it will all help you later. As I witnessed today, it is really interesting. I cannot describe in words right now. But yes, it feels really very nice.
And just adding another part from myself, the first day of your MBBS, how was your experience? I mean, what was your experience on the first day itself when you have joined and you've appeared for the exam and you know that this is my first day as an MBBS student? So, what exactly was it all like 1 year back?
I remember it was first Feb when we came here. First Feb, then 2 days we were told that you will have to stay in the hostel only because it was Corona period. Then on third or fourth Feb, we met for the inauguration ceremony in the lecture hall. There we went like this only, and white coat was with us, but it was a white coat ceremony and it was really amazing. Like we wore white coats in our schools also for practicals, but that was something really really special when your teacher uh, uh, let you wear it. It really feels very very nice. Then after that, I remember today, that was I guess Monday or Wednesday. So we were having our NAT dissection. So we were told that there will be formalin. So some kind of smell or everything will be there. So be careful. After seeing the cadaver, many can faint. So be some kind of chocolate or anything, just put it in your mouth. So we got there, everything happened. Then suddenly we hear a noise of stool. Everyone was like, "What happened? What happened?" Then there was a boy who fainted right there. We all were really very panicked. Then everything was normalized, and slowly we all got acquainted to it. But really, it is fun. Just first few days, you will get time to be in there. Like we say, हम हिल पे जाते हैं तो acclimatize होना होता है, वैसे ही we'll acclimatize here, and after that you'll really enjoy a lot.
Right. Thank you, Koshika, for sharing your honest experience with the students. All right. So coming to Rohan, I have a question for you, and I would want if you could help Ramya with this. So Ramya says, I completed my internship in 2016. Because of health issues, I joined degree in 2019. And now I'm interested to become doctor. But her friends and families are suggesting that it's too late to join in MBBS as a girl. So she needs a recommendation or an advice that should she go for this year, or should she take a drop? I mean, drop the idea of becoming a doctor and getting again enrolled. So Rohan, what would you like to advise to Ramya?
Okay. So what I would like to say as a general point is it's never too late to become a doctor or pursue your dreams. So I understand that you were sick for 3 years and now you're trying to make a comeback and join a course like an MBBS course, and you want to perform well, or would you be able to do it? So what I would like to say is it's completely possible. And looking at from your point of view, you most of the students are doing MBBS because they want to pursue their dreams. So
Rohan, can you hear us? Okay, meanwhile, Rohan gets back. We'll just, Kushika will move to some
you
more.
should go.
Yeah, Rohan, I think there was some technical glitch on your part.
Okay.
Yeah, let's continue.
Okay, can you tell me where I missed out on the feed so I can continue?
Yeah, we could just go back one line and discuss about MBBS. Like, is this the right time for her to go?
All right. So right now, medical life is everybody is choosing to be something else, and everybody wants to leave a mark of their own in this world. And if you want to pursue MBBS after a long break, I would say, and if you are already into it and you're ready to give the Neet examinations and you know what you're going through and what you will face, I would say you should completely go for it. And MBBS course, if it's not difficult at all, and you can completely cope up with it. It is, I would say, it is just a more severe version of what you faced in 12th standard. But over here, there isn't anybody forcing you to do anything. It's just you and your ability to how much of you can perform.
I totally agree to it. Okay, I'll take another question, Rohan, which comes from Khuteja. Which year of MBBS accurately let us know our knowledge application capability?
Okay. I would say for you to actually test out your skills, which you've gained throughout the years, I would say it would be final year. But for even for most students, I would say final year is the part where they get to have more experience, and then they get to see more things. And that's where they just don't read the practical aspect of it, but then they start reading the everything in theory. They get to the molecular level, and then they get to the clinical aspects about how it actually happens. So I would say if you want to actually put your skills to test, I would say it would be the internship. It's when you are out of all the 4 years, and it's when you have all the knowledge, and that's when you'll be able to put it to skill, and you'll be able to travel to the hospital every day, and you'll be writing case sheets, and you'll know that, okay, this is what the case sheet looks like, and this is what it is. And you'll be actually really happy and satisfied that, yes, this is a person who has diabetes or hypertension complications, and I know what they are, and this is how they present to me, and I know how to read them. I would say that would be the best way to actually test your skills.
Right, Rohan, thank you for that answer. I'm sure that would really help the concerned person. Okay, let's go to some more questions that I could see here. Saurav wants to know, after MBBS, suppose I want to do MD in subject of my choice. Is it easy to get any branch of my choice? So Rohan, if you would like to help him out on that.
All right. So if you want to go for MD, right now we live in a very competitive world, and if you want to select a subject of your choice, we would have to be in the top most ranks. And plus, if you're in the general category, I would say it would be a tad bit more difficult to get it in the particular college. But if you want to get into the particular department or so, I would say it would be, you can do it. It's not impossible. you can get into the department, but if you want to get into the particular college, I would say perseverance is a key ingredient in it to get it. But yes, you can absolutely get a choice of your department or MD. And plus, we do have new departments coming up every year. So if you want to let your thoughts go wild or you want to try out new things, if you are interested in some of the new departments like plastic surgery, emergency medicine, or robotics, something like that, so you can completely go for it.
Right. Thank you, Rohan, guidance. And I'll just move to another question. And Koshika, I would like if you could help Aisha on this question. Aisha says, I really want to become a doctor, but I don't know what exactly to do. She does not have any medical background. There's no guidance. And it's a childhood dream. And she really does not want to opt for any other field. So, Koshika, can you really guide her up on this a bit?
I guess your situation is same like me. I also don't have any medical background, and I want to be in this field only. So it's not. Sorry, the question.
So she wants to know, I mean, what exactly should she do? Because she does not have any medical background or any guidance,
Okay.
but she really wants to take up this dream. So what
Mm-hmm.
exactly would you suggest?
uh, like if you are in you are pursuing MBBS, then just go with the flow. Just study, and what else? Like you can get guidance from your professors, because the professors are really helpful. Like in first year, you will be allotted some your mentors, whom with you can share everything. I was same situation was with me also. So mentally and with your studies also, they will help you a lot. Just try to interact with your faculties, and more try to interact with your friends, right? And try to groups do group studies, and interact with more of your seniors. They can tell you like what to do, what not to do, because we all are in same profession. So you can take guidance from your seniors. They are really helpful, and of course professors in first year, they'll really help you.
Thank you, Koshika, for that answer. I'll move to some other questions over here. And Rohan, I would want you to please answer this for Abhay. So Abhay says, what is the chronology of the topics to be studied over the 5-year course? If you could help him in with the different topics, like what all topics are there for the entire course?
Okay. So in the beginning, for the first year, we just try to lay down all the foundation principles of the entire body. So we start with anatomy, physiology, and biochemistry. And for the second year, we build on what are the different pathologies or abnormal things you can find in the being. So that would be our second year. So we have pathology, we have forensic medicine and toxicology, and we have pharmacology and microbiology. So this is all your subclinical part. And after this, we move on to the more clinical part. So in our third year, we have our community medicine, also known as prevention of social medicine. And after that, we have our, along with community medicine, we have our ENT, also known as otorhinolaryngology, and our ophthalmology. So over here, we have our complete base for our clinical subjects. And this is when we get to know about what the different clinical subjects are and how we get into it. And the last is final year, where we get complete exposure to the real deal of all the clinical subjects. We have medicine. Medicine also contains dermatology, radiology, and psychiatry. And we have our surgery. Surgery also has a part of orthopedics. But if you're looking at from posting point of view, as visiting the hospital and checking out which all cases we have, all of them will have separate postings of 1 month. But from the subject point of view, yes, medicine, surgery, then we have pediatrics, and then we have obstetrics and gynec as the last subject. So these are all the subjects you find in the MBBS course.
For the year, so I think that will really help. Okay, let's come to some other questions. So we are also getting a question regarding opportunity for paramedical students. So Rohan, what exactly would you like to suggest for paramedical students, and what guidance would you have for that?
Yes. So paramedical students are, there are tons and tons of people sorting after paramedical staff. So that we have our matrons, we have our nurses, our ward boys, and I say all of them are very, very important in the normal functioning, just the normal functioning of a hospital. So I would say paramedical staff is extremely important. And if you are trying to pursue somewhere as an intensivist or a night shift doctor, you would need somebody as a nurse to assist you. And even for surgeries, I would say the paramedical staff is extremely vital in conducting your surgery or any other procedure. So paramedical staff is extremely helpful, and sometimes it can be very rewarding when you have to take the matter into your own hands.
Right. Thank you, Rohan, for that answer. Koshika, coming to you. Since Koshika, you come from a government medical college, right? So there's a question coming up. What is the difference between government MBBS seat and a private one, except for the fee structure? What major differences would you say? And how was, I mean, what was your take? I mean, why did you opt for a government college? Do you find it's a better thing, or a private one would have been better? What is your take on that?
uh, uh, I don't think there is any difference between government. Like everywhere, you will have to study on your own. The main difference comes is the exposure to the patient, I guess, apart from fees. We have to choose where we will get most exposure to the patient. Like if I talk of Gujarat, here most of the population lives in Ahmedabad, Surat, and Vadodara. So if anyone would get a government college apart from these cities and a private college in Ahmedabad or somewhere else, they would definitely prefer Ahmedabad over any other place if they are not into financial things, because there obviously the number of patients will be more and you will be able to get more cases and more diverse cases, I would say.
Right. Thank you, Kochika, for that answer. Okay, Rohan, coming to you. We have already got to know about Koshika's first day experience and how all it was in the first year. But since you're the final year, we would like to know how was your experience in your first year, and how was it with your seniors and with your faculties? How overall it was during your first day, if you remember your first day and your first year.
Yes, I would say our first years are some of the days which we'll never forget. So, somewhere in September, we joined our first year, and I would say I was mixed with having being nervous and being excited, and it was a feeling which you get joining a school after a very long time, where you don't know anybody, you're starting everything from scratch, and you don't know the place, you don't know anybody there, but the one thing is that you have your passion to do your own thing, and that is to become a doctor. So when I joined my first day, it was it didn't feel any different from a 12th standard class on the very very first day. So we just went and we attended the lecture, and after a few days passed by, and we started having our practicals more often, and we had to get our for our hematology classes, we had to get in our own blood, we had to prick ourselves, and for the dissection we had to look at all the muscles, just separate it. And there are a variety of different bodies where everybody keeps comparing. I got the heart, and I got the heart properly. I'm wearing I know how to hold the liver properly. And I would say it just kept deepening the experience of what a medical student actually feels like. And after that, like how Koshika talked about the smell and all of that, it just gets easier. And we had to get the bone set from us. And I think that was a different experience altogether. And I don't think it's going to come back. So I would say enjoy your first years thoroughly. And I would say when I was in my first year, I was in my hostel, and I just went there and I settled down and just looked around for the people of my class, and there were a few across the hall, and most of them in my hall they were seniors itself. So I went around and talked to them. All of them seemed really helpful, and yeah, the most impressive part of the hostel is it's not just one particular year who's living there. You'll see people in different levels of being a doctor and different responsibilities and having different roles to play in the medical college. So before we are just brushing our teeth and we see interns getting up early in the morning, dressed sharply to get to the hospital and get to work immediately. And then we have our third and fourth year students who also get up way before them and they are studying. And here we are, we're just looking around. Yes, this is what I signed up for.
Right. Suran, just adding another question, since you have already fared for major of the years, which year do you feel is more harder for a MBBS student? Is it the starting phase or is it towards the end? I mean, this question is also coming in here from John. So wants to know, like, which is the toughest year, the starting ones or the ending ones?
All right. So I would say in the beginning, we'll face a little bit of traction as because we wouldn't know how to exactly grasp the topics and how to go about it. And all the examinations are completely different from how they were conducted. And we'll feel like we need to do more and we need to study properly. But as the years go by, we get the knack. Okay, this is a particular topic. I know what to study, so these are the headlines for an answer which I have to write in an exam. Okay, but if the same thing which somebody asks me, this is how I will present it. And if the same thing, if it's asked to me by a doctor in the hospital, I would give him these all topics, these all points, and that is how I would present myself. I would say the it gets harder as you go, but then it just gets way more uh, uh, intensified, and you get more pleasure out of studying because it is as rewarding as it is. You go to the patient and we check all of that, and it is exactly how we read it in the book, and we're like, yes, this paid off. So I'm going to read more tomorrow, and I'm going to see if I'm going to see the same thing tomorrow itself. So I would say the tough gets going, but we get going with it harder too, so it gets simpler.
Right. I really could resonate to that and understand your point of view. And I think a lot of students would totally agree to your fact. All right. Koshika, coming to you, I have a question regarding the coaching. So students here want to know, is it better to study from notes that they get from coaching centers, or they should go with the standard books which are there, but they're a bit of lengthy? So what would be your suggestion for, preparing?
Uh, I would say it particularly depends upon the person, what kind of person you are. Like I am a kind of person I cannot read anyone else note. I'll make my own notes and study it. Like in first year, and art was a vast subject. So I would summarize it in one notebook, and before exam I'll read that only because I can't go with the book. In notebook I know that this much I have written, and exam I have to write this much only. So it depends upon you. Test yourself what kind of person you are, because definitely the notes from the coaching are very good and it will be very helpful to you. And in some subjects like biochemistry, I don't think that making notes would be useful. For that you can go through the book only, because I guess in biochemistry 40% part is from your 12th only. So you just at the last you will have to go through your 12th books only, because I have done that only.
Right. Thank you for that answer, Koshika. Okay. So I have a question coming up repetitively, and I don't know, Rohan, if you would like to help her with this regarding BDS. So, Alicia wants to know, is BDS of same importance as that of MBBS? Also, if it's for BDS, do you have the same kind of, I would say, paying structure like a doctor is being paid, or is there a kind of difference? And the vibe and the feel of a white coat and the stethoscope that is there attached to a doctor, is that the similar thing for BDS students also? Because I could see a lot of queries regarding BDS.
All right, that's an interesting question. So what I would say about BDS is, when I was staying in hostel, there were plenty of BDS students, and we all used to stay together and live together and study together. So I would say BDS, the only part of it is that you have a different set of years and it gets over early. But then we go through the same pain and the same way of studying. So I would say BDS is, a lot of people are now taking BDS, and dentists, good dentists, we all require good dentists and they are sought after. So from a financial perspective, one about the other, but it's a 3-year course plus one internship. And in the beginning of your years in BDS, they will teach you about the body and mostly about the head and neck structures and the diseases of the head and the mouth. So you will get a part of the medicine, but only related towards the buccal region. So, and there are plenty of more other subjects in BDS like orthodontics and making molds and surgeries. So, I would say it is an interesting way of life, and I would say BDS is moving forward day by day.
Right. Thank you, Rohan, for that answer. And I have another question which has been asked particularly for you. So I would want, Rohan, if you could answer this. So the question comes in, what all you are studying now in 4 years, what all you have studied in 4 years theory, do you remember or whatever you have studied? And is it helpful to check patients, or just practicals is necessary? So this question comes specially for you.
Okay. So right now I finished my third year and I'm just into my final year. So what I would say is, yes, what we learned in the past years is helpful, and it won't all come to us at one particular moment, and it won't be one final question which determines everything. So I would say it's a wide array of questions and topics, and it's about how we can apply this knowledge elsewhere. So if we had learned a particular topic in biochemistry, and the same thing is the what we learned in biochemistry about the metabolites and the different metabolisms is very helpful in treating your alkaline metabolism and treating your acid-base metabolism and all, balancing them, and what respiratory alkalosis is and metabolic alkalosis is. So we get a different standpoint. So we will get the basics of what we learned in medicine from biochemistry. So I think it's important to not lose touch of our basics. But as we keep studying our fourth years more and more, they do have most of it from our first years, but we do refer to our books back again and again to check, okay, this is what I had read before. So this is what they meant when they meant this is what we'll see in the diseases. So I say it's very good for correlating.
Okay, and I just want to extend another question, Rohan, since we are almost towards the end of the session. Since there are a lot of aspiring students, and they just want to know about the different specializations. For example, if they're doing MBBS, so after completing, how do they get to choose the different specializations of being a doctor, like a heart specialist or a neurologist or some other specialization? So what exactly is the procedure to opt for that?
So after we finish our internship and medical life completely, we give our Neet UG. So in Neet UG, it's all about choosing one subject which you have completed in your MBBS course. So let it be medicine. So then you'll become a MD in general medicine. So then you'll be called a general physician. But if you take up dermatology, the same part, then you'll be called a dermatologist, a skin specialist. So, but if you take up somewhere in anatomy or physiology, you'll be known for such things. So, all that will be our for our post graduation, only for our, as our medical topics. So when we go into our super specializations, we are branching into subtopics into our own subjects. So let it be our own skin diseases. We'll have to go into diseases as I'll treat only this layer, or more into cosmetology. So I'll become a cosmetologist. So a laser specialist. So you can go into all different kinds of topics within your own mainstream of what you're taking in a post graduation. So if you take your general medicine, so general medicine consists of your cardiology, respiratory system, and you can become a pulmonologist, and you can go for emergency medicine, and you can also become an ICU intensivist. And over there we have our CNS system, so you can choose neurology. But you can, if you want to go for psychiatry, I say you can go for it in your post graduation itself. So I would say as you go for more and more courses and more specializations, is just branching more into one single subject and reading it in detail again and again.
Right, Rohan. So before I wrap up, I'd like to take another last question that has been coming in with a lot of requests. So let's just try and help if we could. So this question comes from R. Renu. She says, last year I joined in Philippines, but this year I have rejoined in India. So she wants to know, is this a good decision? And she also says that there in Philippines, it was full of MCQ, and in India, it is question and answer. So she wants to know, can you please help me, tell me how to adapt myself to this education? So Rohan, if you could like quickly help her out with this.
Yes, absolutely. So if you're moving from the Philippines to here, I would say the one drastic change would be the curriculum, which you'll be following here. So based on and that too based on which state you are part of. So every state has their own different set of curriculums, but the pattern they follow is more or less same, but the curriculum will be a tad bit different. So as per answering the MCQ point of view, I would say hold on to it, as it would be really, really helpful in your RS4. In Karnataka, we have the RS4 type of curriculum going on, and MCQs is a part of it in every single examinations. And also in Neet, PG, and all the entrance exams, we do need MCQs. So I would say hold on to that aspect of it. But question and answers, I say, is really helpful as we get to know the in-depth part of it. And even if we miss a part of it, we can come back and we can judge ourselves. Okay, this is what I don't know about it, and I can improve. But I say that would be the drawback of MCQs, as everything is laid out. You just have to choose one.
Right. Right. So I think, Renu, that would really help you out. And I think Rohan has tried his best to help you. So last question taking from Ananya. After a lot of requests, I have to take this question from her. She wants to know about USMLE. If we wish to pursue this, which year should we start our preparation? So just brief it about the exam and preparation, please.
All right. So I would say, yeah, if you're trying to go abroad, whether it be USMLE, PLAB, or trying to just go into your Canada or Australia, main thing, it would start off with your CV building. So that is what most of the students will start off with in their first, second years, if they are really, really dedicated that, okay, I'll finish my MBBS here and I'll plan to settle in US as a doctor. So those people will start off joining other organizations, and they'll start off their prep in first and second years. But from giving the exam point of view for USMLE, it comes in 3 steps. So step 1 is completely your subclinical part, your paraclinicals, and you would have to give it somewhere in your 3rd year, which is the ideal time. But you can also give it after your internship. The reason why people choose step 1 in the 3rd year is you can go for your electives in your during your internship to America and gain more experience there. But after you do it after your internship, it would be known as observerships. So you don't really get hands-on experience there. Step 2 would be clinical knowledge test, and step 3 would be your just finalizing CS type. But right now, CS has been stripped off from the steps. So step 3 would only be for getting your visa, your H1B visa. So if you have to give an English exam along with your step 3 to get your H1B visa. So I think you can complete your entire thing in ideal would be around 3 years, with 1 year each exam to give. If I have answered your question, uh, thank you. But if you have any doubt about it, you can ask about it. If I have missed
Right.
anything.
And I know that the time is less, we need to wrap up, but I am repeatedly getting a question here. And I don't know if I'm allowed to take just one last question from Kapish, if we can take this last question. So he says he's a 12-year class 12 student, and he's a PCB student, and he wants to be a doctor, but he's more into clinical psychologist. And he's also says that since it's a 7-year duration, same as of a doctor, but he got to know that a clinical psychologist gets less of payment. So he has been advised not to go for this field. So he wants to know which course is more beneficial, BSc in mental health or BSc in psychology. So Rohan, if you like quickly help Kapish with this, please.
Okay. I'll try my best answering this tricky question.
Yes.
But the thing is, psychology is more about knowing what the mind can do and how it will think. So if you actually want to go for it, I would say you'll get a different point of view and about being a therapist or being a psychologist, and you can work in different institutions. But if you want to go for mental health, I would say it would also be a different standpoint of view, as you'll have different opportunities to come by. So I would say psychology, being a therapist, mental health are overlapping topics. And if not, if I'm going wrong and saying overlapping, I would request your apology. But I would say psychology, as we have seen, or psychiatry, and we have studied all the neuropsychological disorders and mental disorders. I would say most of them are overlapping, but your mental health is more of what you can observe, and psychology is what you will observe if you know the history properly.
Right. So thank you, Rohan, for that all guidance and answer. And I would request all the students, if you could see a feedback poll on your screens. So I would request all of you, if the session was helpful to you and the speakers could help you with your queries. I'm sure there's a constraint of time and we could not take up all the queries, but we did try to take all. Please fill up this feedback poll as this will help us to improvise for our next webinars. And if I could see a lot of questions have remained unanswered. So for that, I'm sharing a link where you can always put up your queries, and our experts and panelists would be there to help you and guide you through any of your queries. So you could make good use of this link. Also, if you have missed out this video, the entire video will be available to you on our official YouTube channel. So I would request all of you, please subscribe our channel and you could get to see the entire video. So do not worry, the entire video will be uploaded there. So do check out that. And lastly, thank you, Rohan and Koshika, for your entire timing and for all that information and all your experiences that you have shared, and you tried to answer so many queries. So, Rohan, your last piece of advice to all the students.
I would, before I give out my final piece of advice, I would like to thank shiksha.com and Bhavishay Gupta for giving me the opportunity to be here and help out so many people who need answers and help. And for my final piece of advice, I would say, if you think you can do it and if you want to do it, there's nobody who can stop you. Go for it. And effort you put into.
Right. Thank you, Rohan, for that. Koshika, what would you like to say to all the students?
I really enjoyed the seminar. Thank you, ma'am. And really, it was very helpful. Many questions which I want to know, sir has answered many of them. It was really helpful. And at last, I'd like to say, sky is not the limit. Just increase your potential and you will do fine. All the very best. And medical life is really fun. It is not like we are always into books. We also enjoy a lot here. Thank you.
Right. So thank you all of you for joining us here, and please check out our YouTube channel for the entire video, and hope to see you again with some other topics and sessions. Thank you.